basically clinging to the eardrum. And this does cause symptoms, so it does cause dullness of hearing. And the patient also reported this kind of weird sort of on and off feeling of fullness in the ear, specifically if the ear got wet, which makes sense. So, and what we're going to have to do is basically peel this off the eardrum. And so I've applied some sodium bicarb here. But I wanted to upload this video because, well, for two reasons. First of all, I think it beautifully extols the virtues of an endoscope. So this probably could be done quite easily with an ENT microscope as well, but it's just very easy with an endoscope. So because you can get right up close to it, near enough see inside the recess. So, but the second reason I wanted to upload this is because these cases are quite deceptive in that the problem is often way worse than what it appears. So right here, I think most of you at the start of the video could see what was wrong. There was like lots of kind of wavy dead skin loveliness in the bottom right or anterior, inferior part of the drum, which is fine. But cast your eye to the bottom left or the posterior inferior quadrant. That sort of tarnished yellow appearance of the drum, that is more eotimpanum. That needs to be removed, otherwise the patient's symptoms will never go away. And you can't really see it at the moment, but there is tons of dead skin hiding in the posterior inferior recess, and that you can sort of see it there. But mistakes I've made before with these cases are that I've kind of got the easy bit, and then the difficult bit I've just basically just left it and in the hopes that it would go away, but it never really does. So what we're going to have to do is go into that recess, grab the skin, and then peel the skin off the eardrum, so from posterior to anterior, or left to right in this case. So, and this is the difficult bit because it probably doesn't seem this way in the video, but it is a really awkward angle for me to get into. So it's very, very difficult to get the suction tube in there. So what I'm going to do is, what I'm doing here is basically trying to catch the lip. So I'm trying to find a suitable place to peel the skin from. So, and it's going to be, you're going to get a more sort of complete result that way rather than starting on the drum and then peeling all over the place. It's just not going to work. So there's the lip, and you can see now the extent of the problem. So the eardrum was not clean just from getting that first bit. We need to get this next bit. But this isn't going to work, so I'm going to apply some more sodium bicarb here. Now the video is highly edited, obviously, massively abridged, but this, there was about 10 minutes where of faffing around trying to find this lip again and then trying to find the correct place to peel it from. But we did get it in the end. So that's, after much faffing, that's where it was. So I'm going to just peel from posterior to anterior, and problem solved, happy days. And if anybody's wondering, does this kind of show up on test results? Sort of. So it wouldn't show up in a normal tympanogram, for example, but I did do a wide band tympanogram before and after, and it did show up. So if you look at there is definitely a difference before and after the result. So you can see here the eardrum might look a tad inflamed here, but I've just blacked up the exposure and changed the camera settings slightly, so it just looks different from the previous footage. You can see the exposure's a bit higher here. So here we are, and this is now the kind of final peel where we'll kind of free the eardrum of this neotympanon, which has been plaguing the patient actually for a long